Okay, so we've got to the point where you've got a bunion. Okay, you know it's a bunion, or is it a bump on your foot? Do you know it's a bunion? Is it really a bunion? So we'll answer those questions as we go along. Number one, when do you go and ask for help? And number two, who do you go and ask for help? So number one's pretty straightforward. Okay, so if anything's causing you problems in the body, so pain essentially, you've got to go and ask for help. You shouldn't be in pain. It's not fair. It's not a great quality of life. You should, put yourself first for once, I'm sure, and then go and seek some help. But who do you ask? All right, and this is why I think it's really important internationally to work as teams, as all therapists to work as teams, because often a patient, and I'm speaking to patients, or a therapist, and speaking to therapists, will have friends and colleagues who can recommend either or other. And that said, a patient will go to a physio, for example, and say, hey, my friend saw you, you were amazing, or you looked after my shoulder, you were amazing. I've got this problem with my foot now, I've got this burning, what should I do? And that's where, as a therapist, you say, well, hey, there are a couple of options here, which I'm sure you know, and say, well, it could be broadened footwear. Sometimes an orthotic might help if it's a hindfoot-driven problem. It's a separate story, but there is a potential space in orthotic. And then it's really, do you need surgical opinion? Do you need some help with regard to surgery? And this is where I think researching your surgeon is really important. So in the UK, for example, I'm an orthopaedic surgeon, I'm a doctor, and this gives me a little bit of qualification to further qualify. I did fellowship training in Australia, subspeciality training, which included keyhole and minimally invasive surgery. And so it's kind of my bag, it's one of the things I do. I'm also sports qualified, which means that my mantra is really to get people going as quickly as possible. That's great. So that's my sort of background. You've had a look at who I'm saying I am. But at the same time, you can have a look at what patients feedback with as well. Now, it's really important that reviews are reviews, right? You can look at genuine ones, but generally speaking, you'll see a trend of happy, pleased patients with people that you want to see. And that could be a physiotherapist, it could be a chiropractor, it could be an osteopath, it could be a podiatrist, it could be an orthopaedic surgeon. So do your background research. We do it when we go on holiday. We should do it when we're looking after our own bodies and our own health, right? So there's number one tip. And I think then it's kind of a crossover with what I talked about before. As a therapist or as a surgeon, plug into your colleagues, speak to them, make them aware of what you can and can't do. Have a chat to them about patients, look at case studies, share your data, share your information. I think it's really important. I published a paper recently in Foot Ankle International, September of 2019, which is a great study of keyhole bunion surgery using a validated scoring system, which is fantastic. So you can look at evidence if you like to look in that detail, or look at patient reviews if you like to look in that detail. And then finally, go and speak to the person and say, look, I've got this problem, what do you suggest? Let them do the talking as much as I am doing now, and explain to them, hopefully, what you know and what the problems are. Now, I'm just going to segue back to the beginning, and that was to say, you've got a bunion, or have you? And that's to say there can be an overlying here. So a swelling in the big toe joint, or a bunion, could also be arthritis in the big toe joint. So please be aware of this. And often the bunion is the bump on the side, arthritis is the bump on the top. Both can be tackled keyhole, and it's really important to discriminate between the two. I'm sure we'll do a post on this in the future just to give you a few details between the two in terms of how I would approach it, what the pathology is, and how to recover as well. But it's just a flavour for you there to start off with.